I get asked a lot about how do you avoid deep vein thrombosis when you're flying. And this has been called economy class syndrome. And the reason is because for certainly flights of more than 4 hours, there is a small but definite risk that people will get a deep vein thrombosis, or worse still, a pulmonary embolus, which is a clot to the lung. To avoid this, I would suggest most people need to just take simple conservative measures. They don't require any drug treatment. The simple conservative measures are, firstly, you should wear elastic stockings to the knee during the flight. I don't recommend flight socks. I think go to your chemist shop and get normal grade 2 elastic stockings to the knee, the sort that somebody would wear for varicose veins. That's the type of stocking you need. You can get them in black, so nobody needs to know they're elastic stockings. Secondly, you need to stay hydrated. This is difficult for some people because it means not drinking alcohol for 24 hours before the flight or during the flight, and drinking probably about a half a litre an hour during the flight. So you're going to have to carry some water onto the flight with you to keep hydrated. And thirdly, you should exercise or walk every 30 minutes during the flight. So if you've got an aisle seat, you can wander back to towards the toilets and wander around the airplane every 30 minutes. Alternatively, you can just look at the flight magazine, which has perfectly good exercises, which you should do every 30 minutes. Now, that's what most people need. As regards drug treatment, there's actually some, but very little evidence that aspirin prevents deep vein thrombosis. Aspirin's an excellent drug for preventing arterial thrombosis, which is like arteries, things like heart attacks and strokes. But it has absolutely no place, in my opinion, for the general prevention of vein thrombosis. What I would suggest you use there is just the basic measures. If patients, however, have a greater risk of a clot, and they will know if they have, because I'm talking now to people who have had a deep vein thrombosis in the past. In that case, you should definitely consider drug treatment. And nowadays that means taking enoxaparin, which is a subcutaneous injection which the patient can give themselves. And I suggest you give yourself 40 milligram injection of that into the skin of the tummy the day before you fly, the day of flying, and the day after flying. And you do that under medical supervision by probably your family doctor. If patients do that, if they're in the high-risk group, they should be able to avoid DVTs and pulmonary embolus. But let's go back to the most important message from this presentation. If you're just an ordinary risk person and you're going on a long-haul flight, do the basic measures, the stockings, hydration, and exercise, and you should be fine. And if you want any further information, if you contact Vein Clinics of Ireland, and our contact information is given here, you can get a handout or a leaflet on avoiding deep vein thrombosis when flying.